Hey there, beautiful people. Whether you're seasoned practitioners or just starting out cupping therapy at home, this video is perfect for you. I'm thrilled to guide you today as we explore the fascinating world of this ancient healing art. Together, we'll dive into techniques and tips that will benefit everyone, regardless of your experience level. In today's tutorial, we'll be using the AccuZone cupping set, available on Amazon for just $37. If you're interested in checking the set out, you can find a link in the description below. I found this set to be reliable and versatile, and I've been using this for many years with my patients, yielding consistently positive results. Before we begin placing cups, it's important to ensure that the skin is properly lubricated. In my experience, using oils or gel tends to work best for this purpose. Lotion can sometimes stick and drag too much on the skin, but ultimately, it comes down to personal preference. When deciding on the cup size for your treatment, it's important to consider the area you'll be working on. For broader areas like the back, opt for larger cups, while smaller cups are better suited for more focused treatments, like the traps or the pecs. I like to use the remaining oil on your hand to lubricate the rim to create a better seal on the skin. Also, a tad around the nozzle of the cup so the pump can come off with ease. It can be stubborn and feel stuck sometimes. Position the cup firmly against the skin and push down to ensure a good seal. Begin pumping the handle of the pump. With each pump, you'll gradually create suction inside of the cup, causing the skin and underlying tissue to be drawn into the cup. Continue pumping until desired level of suction is achieved. Start around 2 to 3 pumps of suction to initiate the process gently. Assess the patient's comfort level and gradually increase the suction as needed.
5 minutes later.
Aim for a gentle to moderate level of suction, avoiding excessive pressure. Pay close attention to the patient's feedback and adjust the suction accordingly. When placing multiple cups, find the best fit by positioning them roughly around 2 finger lengths apart. Let's discuss how to remove the pump from the cup. One effective method is to pinch the cup's edge between your thumb and your index finger, creating some sort of wedge. Then, while gently twisting and pulling away from the cup, gradually remove the pump from the cup. This technique is simple yet worth noting for its effectiveness. Now let's move on with our session. When it's time to remove the cups, gently pinch the nozzle at the top of the cup to release the suction. As you do so, you can also use your thumb to massage the cupping site in a small circular pattern, providing a soothing sensation. Trust me, it feels quite nice. To maintain consistency, remove the cup in the same order they were placed. In our case, start with the bottom left cup and work your way up, ensuring that each cup has been on roughly around the same time. This helps to balance the treatment and minimize any discrepancies in suction duration. I have a helpful chart here to assist in interpreting the results of the cupping session. It's important to take the time to carefully explain these findings to the patient, as they may not be able to see the results themselves. Here are some extra pointers for cup removal. Sometimes pinching the nozzle can be tricky, especially if there's a lot of lubricant or you have short nails. In those cases, I recommend using a gua sha tool as a wedge to lift the nozzle. It's a handy alternative. Remember, the stronger the suction, the more challenging it can be to lift. Additionally, to streamline the process, I like to place each cup I remove onto each finger. This helps minimize interruptions and keeps things organized and efficient during removal. Now, let's interpret the results for our cupping session and communicate them effectively to our patient. Based on the marks observed, particularly the ones most superior on the upper traps and bottom left on the low back, we can classify these as moderate stagnation. As massage therapists, it's crucial to document these findings in our soap notes, indicating areas of concern and future sessions. By noting these areas, we can allocate a generous amount of time to address them specifically during next visit. This ensures that we provide targeted and effective treatment to promote optimal healing and relief for our patients. Here's a quick recap of the cupping process. It's essential to begin by assessing the needs of the treatment area. By pressing on the skin, you can estimate how many cups will be required for an effective session. Once determined, the next step involves preparing the skin by applying lubrication to both the skin, the rim, and nozzle of the cup. With the skin adequately prepared, firmly press the cup onto the skin to create a seal. Initiating the suction process with 2 to 5 pumps. Throughout the session, it's crucial to regularly check in with the patient, ensuring their comfort level and adjusting the suction as needed. After allowing the cups to remain in place for
5 minutes later.
to achieve the desired therapeutic effect, pinch the nozzle's edge to remove the suction. Remember, the more pumps you use, the harder it will be to release the cups, so consider using a gua sha tool as a wedge if needed. And don't forget about those delicious thumb circles. Trust me. Finally, assess the results of the cupping session, using the provided chart, and provide feedback to the patient about their condition and progress. Throughout the entire process, maintain open communication with the patient, prioritizing their comfort and safety at all times. Now moving on. As a massage therapist, it's important to be aware of certain contraindications when it comes to cupping therapy. These are situations where cupping may not be suitable or could potentially cause harm to our patient. Firstly, if the client has any skin lesions or open wounds, let's avoid cupping in those areas, as it could make the condition worse or lead to infection. Similarly, clients with hemorrhagic disorders which affect blood clotting should be cautious, as cupping might increase a risk of bleeding. Pregnant clients need special consideration too. While cupping can be safe during pregnancy, we need to avoid certain areas and techniques that could pose risk to the client or the baby. Also, it's best to steer clear of cupping over varicose veins, as it could be uncomfortable or aggravate the condition. Clients with sunburn or severe burns cannot receive cupping, as it could further damage the skin or delay healing. Oh, and for the record, the upper glutes, right where that glute medius is, insanely sensitive for a lot of patients, so move cautiously. Lastly, for clients with edema or fluid retention, cupping might make swelling worse, so we need to proceed with caution. Understanding these contraindications is crucial for ensuring the safety and well-being of our clients during cupping therapy. Always prioritize the client's health and comfort above all else. To improve accessibility, consider placing the cups at the edge of the table. Alternatively, you can place the cups by the calves between the legs for another accessible option. Moving on. While not everyone likes or prefers stationary cupping, I found that many people enjoy the sensation of gliding cups, also known as running or moving cups. For this technique to be effective, only use about 0.5 to 1 pump of suction. Anything more than that can seem less smooth or abrupt. We'll follow a straightforward pattern. Glide over the rector muscles, then move over some of the scapula muscles and traps. The goal is to generate heat. Notice how quickly the skin turns pink? I don't move too fast nor too slow. Find a rhythm that feels uniform and smooth. Create a small land bridge at the bottom, low back, for a seamless transition. When gliding over bony landmarks like the spine or the scapula, lift the cup slightly to ensure a smooth passage. Now, this is the boring approach. Let me show you a more refined and elegant way to incorporate this into the warming. As you all know, I like to reward those who have stuck around until the end with this final technique. This is why creativity is key. While the first method is effective, we're aiming for something undeniable, not just average. Anyone can do the first one. Let's find a way to incorporate effleurage into our gliding cups. Imagine it like a dance, pushing and pulling the cup in an elegant manner. It's okay to let the cup remain stationary for a brief moment. Use the palm of your hand and provide a stroke while moving the cup. Vary the speed or cadence and keep it interesting. It might take a little practice, but you'll get the hang of it in no time. As you conclude the massage session, consider asking your patient if they'll be open to trying something new. This simple gesture not only extends their session time slightly, but also demonstrates an extra level of care. From my experience, patients typically appreciate the opportunity to explore new techniques, especially if they trust you and your expertise. I often reserve this practice for patients to whom I have a strong rapport with. I found that most are enthusiastic about it. As we conclude this cupping session, I want to express my sincere gratitude for joining me on this journey. I hope you found this experience both enlightening and rejuvenating. If you feel like I've earned your subscription, it would truly mean the world to me. Your support helps me continue sharing valuable content like this with our community. Don't forget to hit the like button if you enjoyed this video. Remember, just like cups that gently draw out tension and impurities from the body, let's continue to release negativity and invite in positivity and healing energy into our lives. Sending you much love and good vibes as we embark on our wellness journey. Until next time, take care and be well. Peace out.